Dr. Danny Chambers.
Thank you, Madam Speaker. Everyone on both sides of the House have sort of eloquently spoken about the difficulty their constituents are finding in accessing primary care. And as the Lib Dem mental health spokesperson, I'd like to focus on some potential initiatives that will help solve these problems. There's a really good initiative in Winchester that recognises that there are many socio-economic problems that contribute to poor mental health. And if you look at the poorest 20% of people, they are twice as likely than people on on average salaries to experience mental health issues. And so there's a fantastic initiative in Winchester where the local NHS mental health services are working with the Winchester Citizens Advice to help people in mental health with mental health issues deal with things like debt, things with monetary issues, housing issues, and it means that they end up spending a huge amount less of NHS resources. The latest the analysis that they did showed that for every pound spent on this initiative, that there was about £14.06 on cost avoidance, as in people less likely to have to then engage with mental health services again. I'd be really keen if the mental health team would be willing to meet with me and the team in Winchester who've come up with this initiative, because it really could be rolled out over the rest of the country. And while we talk about community mental health, we've often talked about community mental health hubs. That's something the Liberal Democrats have been calling for a long time, so that we can engage with people proactively who are at risk of having mental health issues. And we know what those demographics are. You know, when we're doing physical health screenings, you target it towards demographics that are likely to suffer from those diseases. And it's the same with mental health. You know, we know military veterans, we know that farmers, we know that women 1 year after giving birth, we know that the LGBT plus community and other demographics are a higher risk of experiencing mental health issues, and we could be engaging with these people much more proactively through community mental health hubs to ensure that they don't end up then needing to go and access primary health care. And the final thing, Madam Deputy Speaker, is to just acknowledge, although it is secondary care, the long waiting lists from when you go to your GP and you're referred for a mental health treatment. They're huge. They could be months, they could be over a year. And that in that time, people can end up going to A&E. And that takes a lot of time and resources. It costs the taxpayer a lot of money. And GPs in Winchester tell me they spend a huge amount of their time dealing with people already on waiting lists for referral, and they're coming back again needing help in the meantime. So that would really help free up primary care. Thank you.